have with me a very young and a bright doctor. His name is Dr. Diwakar Sharma, who is a regular student of PG DIAMS Rajkot batch. Doctor, you scored 711 marks. Very, very congratulations from our team to you. My first question to you, doctor, would be that how are you feeling, in fact, very first?
I'm feeling very happy right now. In this hectic internship, I'm proud of myself that I'm able to achieve this much. And being in a small center, it was very difficult to find a good coaching institute. And in this, BGDMS has been a boon for me in that case. The whole foundation course of 3 years has been very promising for my score and my future.
Okay, so you've been a regular student of started with three-year course.
Yes, 3 years.
Okay, okay. So, doctor, how is it advantageous to join a 3-year course over a 1-year course that people tend to do?
Basically, it's not possible to do a 1-year course plus internship and score well. A foundation course means that you are guiding the children basically from the first year. Therefore, they will know how to exactly go on with it. The props exams are completely different from this. So, foundation course for me meant that when I joined in the first, I was completely blank about how to prepare. So, when I started classes one by one, they the way in which they teach, the topics which they teach, they are of utmost importance in the exam. So, I started to make a list of all those topics and see them from the reference books too, and then again revise from notes and revise the MCQs concurrently. So that's how you go on with every year which you prepare, every year subjects which you prepare. And foundation course, all your 4 subjects of second year will be fresh. So pathology, pharmacology and microbiology, they are very vast subjects, and revising them in the next year itself is very helpful.
So what Diwakar is saying is that if you space out your preparation over 3 years and you tend to complete some subjects in a particular time frame, then go on to the next batch of subjects, it is more productive than trying to cram everything together.
Exactly.
Right, right. Okay, so Rachit, what would be, I would say, your fear factor when it comes to this exam? What subjects were like a nightmare for you, and how did you go about handling them?
So basically all the cramming up subjects like anatomy, pharmacology, biochemistry, so they were actually a nightmare. So basically I divided my preparation into parts.
Okay.
And
okay.
I did not go for one subject a day. I used to mix up 3 to 4 subjects, a basic subject, a final year subject, plus a small subject like skin or anesthesia or radio or psychiatry. So it helps a lot by dividing your cramming up time into parts.
Okay.
Some part of the day you understand the topic, some part you do cram up, and some part you go for some some science in radiology or some science in skin or some short topics like that. So basically dividing the subject into a 15 or 20-day course makes it very easier.
Okay, so instead of trying to finish like in 5 days, 6 days, you spread it over a longer time, and you try to do multiple subjects per day. Okay,
yes.
So that is Diwakar's strategy, and that's a very interesting point that he made, that instead of trying to cram everything together, you need to give yourself some space and breathing time, I would say, so that you can imbibe all the facts. So coming to internal medicine, Diwakar, how did you go about studying internal medicine?
All right. I started my internal medicine preparation from first year itself.
Okay.
So in first, when I attended your class, I was very confused about it because it's a tough subject, and all the topics which have been taught by you, they were presented in a very concise and very informative manner.
Okay.
So after your class, I took up all the topics that you taught, and I revised the recently asked MCQs and the topics from Harrison too.
Okay.
So that made a
so you studied Harrison.
Yeah,
okay. So Diwakar, I mean, what topics in Harrison do you think that are, I think, important for any student's preparation?
Cardiology is of utmost importance, and in Harrison 19, so too many updates too.
So did you read the whole Harrison?
No, sir, it's not possible.
No, in cardiology I'm saying.
In cardiology, in final year I did a lot of work from Harrison.
Okay.
And secondarily neurology too.
Okay.
Most of neurology I did it from, because it was overlapping with pharmacology and pathology both.
Okay.
So it had to be done extensively to score good marks in that. And one more topic, like the renal system.
Okay.
It is given very nicely in Harrison. So
Okay.
I used to do it that from too.
Okay. 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 So studying internal medicine is always productive, I think.
Obviously, sir.
Yeah. Okay. Okay. So Rajat, Diwakar, how are we gonna plan, especially the revision part in the end?
Okay, so first I will start with the internship part. So
Okay.
how do you go on with the total internship? I had made a personal rule of 150, 50, 15 and 5.
Okay.
That is 150 days, 50 days, 15 days and 5 days.
Okay, that's very interesting.
Yeah,
Okay,
so
okay.
that's my own strategy.
Okay,
That's
okay.
So
Yeah.
150 days means 5 months. So the first extensive reading that you do
Okay.
of whole notes, and make sure one thing, that the thing that you take from February or March, the reading material which you pick up, make sure it has to be with you throughout the course.
Okay.
You are not going on changing on material month by month. That will
So
not do.
there is no point of being a
No.
collector of material.
No,
Rather
no.
analyze the material. Okay.
The notes are great and they are enough for it.
Okay.
Only the MCQs need to be checked from another book, otherwise
Okay.
the notes are complete for that.
Okay.
So 150 days first reading, 50
Okay.
days another reading. It should
Okay.
divide into 10 days gap. So 10 days
Okay.
10 days 4 subject strategy, 10 days 4 subject strategy.
Okay. So which book did you read for medicine?
Medicine, sir, I did MCQs from your book because
Okay.
it was not complete to, it was not, I didn't have time to complete the whole book. So
Okay.
I did your notes whole,
Okay.
and because reading notes takes around 4 to 5 days extensively.
Okay.
And
Okay.
then doing MCQs, it also takes 5 to 6 days.
So something like 10 days at least are required.
Minimum, sir.
Minimum,
Minimum 10
minimum
days.
required. Okay, okay. Divakar, what about the last month of preparation? Because I find that revision time usually never comes. People tend to
Yeah.
collect so much,
Yeah.
and then they're not able to revise. They plan. I mean, everybody says I'm going to revise, but not able to revise. So, what is your advice to students about which month? I mean, by what time should you be able to finish your course? Assuming the fact that somebody's exam going next January,
Yeah.
then what is your advice? By what cutoff should you finish, and then when should you start revising?
I guess November is the month, starting
Okay.
of November.
Okay.
When you have exact 2 months left for the exam, you should stop reading any new topics.
Okay.
Then you will get time to prepare the last year's questions, last year's topics, and revise the whole course again well.
Okay. Okay.
And the last week is of utmost important in reading annexures from all the books which you find.
Okay.
The
Okay.
basic annexures, I found them useful in the last minute too.
Okay. Okay. So Diwakar, let me say, if I have to say day in life of Diwakar 1 week before the exam. So how was it? Like you were a bundle of nerves, or like you were planning something great? I mean, what was your feeling? I mean, these guys can relate to you when they will listen to you. They will relate to the fear that one has, or I mean, you can share your views about what was going on in your mind.
Life was extremely stressful.
Okay.
I also gave up 1 day study just to calm myself down.
Okay.
So that should not be done.
Okay, so
Practically,
okay. So keeping the nerves,
it's very difficult. It's
it is very difficult. But then you managed it,
Yeah,
right?
I picked myself up, and again, so last 4 days I picked myself up again.
Okay.
And went through all the important points, and mostly, sir, ECGs from your book.
Okay.
Very important topic for that. ECGs and
ECGs did not come this time.
Yeah,
actually.
but still, but sir, it's an important part of preparation.
Okay.
It's not going to happen every time.
Yeah,
so,
yeah, absolutely. Because last NEET,
Yeah.
like 4 or 5 ECGs.
And it's very
this
volatile.
time, hardly any ECGs. So
Yeah.
it's a volatile situation.
It's a very volatile situation.
Okay,
So,
okay.
sir, that part, and those renal syndromes, I guess 2 to 3 questions came from
Okay,
that. So,
okay.
those things,
Okay.
you need to revise those which you will forget, like physio
Okay.
and some parts.
Okay. So I think the last minute revision plays an important role, especially the last few days also play an
Yeah,
important role, and
surely they
controlling
do.
your nerves plays an important role.
Surely they do.
Okay. Next question to you, Diwakar, is like I would like you to give advice to aspiring students about how to prepare for pre and paraclinical subjects, especially anatomy, biochemistry, physiology. I
Okay.
mean, what would you advise? Like how many days to be invested, and especially for, let me say, anatomy, how did you go about it? Since you said that.
Yeah. So anatomy is very difficult to prepare in a stipulated amount of time. So it needs to be an ongoing study. And according to the recent trend, they are focusing on the CT and MRI aspects of anatomy too much.
Okay, okay. So that's
So,
not covered in radiology or
so normal anatomy will not be covered, I guess.
okay,
So
okay.
some of the important malformations or some of the important anatomical aspects, like in the thorax and the abdomen, like among important vessels and that all, they might be covered. But if you get it concurrently with anatomy, it will be very easy to understand it.
Okay,
And that's
okay. So how did the anatomy notes provided to you or the class that you attended help you?
the anatomy notes were great. They were best part of it was picture based, and you get all the information at one place. So
Okay,
that
okay.
played a great part.
That played a great role. And what about biochemistry, doctor?
Biochemistry, sir, it was very vaguely prepared by me.
Okay,
But in the last minute, notes will do.
okay,
Not anything else.
Okay.
Because it's very volatile, very
okay.
volatile.
And then physiology?
Physiology, I did Soman Manna's book,
Okay,
and I read it around 3 to 4 times to digest it completely,
okay.
and I pretty much liked that book.
So repeated reading is
Yeah, repeated
is-
physiology is very necessary,
Okay.
and mainly the image-based questions. In the last image-based session of PG DIAMS, it was very useful.
Okay,
So it cleared a lot of concepts around physiology.
okay, okay. So you attended the image-based session
Yes.
that was conducted by PGDMs.
Yes.
Okay, okay, okay. So I mean, those were the images repeated or were the concepts repeated?
Concepts are obviously.
Okay, 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 okay. And then what about pharmacology, pathology?
Um, Pharmacology, I think Gerg sir's notes are too much for an extensive study. So
Okay.
that is the best
Okay.
which you can get. And recent MCQs, around 2 to 3 years of MCQs from Gerg sir's books.
Okay, 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 okay. And pathology?
Pathology, I have revised Vandapuri. I've started revising Vandapuri from the second year itself.
Okay.
And patho was my subject of choice actually.
Okay, okay, okay.
I like patho too much, so I did.
Okay.
I started from Robbins in second year itself,
Okay.
and I finished almost whole of Robbins. And I've been reading Vandapuri ma'am's books in second year, so I did it around 2 times in internship too.
Okay.
So that was extremely useful, and it covered also parallel aspects of medicine, gynecology, and that all.
Okay, okay, okay. So overall, Diwakar, your final advice to aspiring students would be that what should they do currently? I mean, how should they start their preparation?
The earlier the merrier,
Okay,
like that.
okay,
So
okay.
third first is the hitting point for the preparation. So basically, if you join a foundation course, you have to collect the notes first, and then you need to revise all those topics from standard books if you have time.
Okay.
And they will be having pretty much of time in third first. Final year, I guess it will be too hectic, but third first is the starting point. And then they should keep on collecting those notes till the last year, the new topics and new all the newer advances and that all which will be discussed. So stick on with it. All the faculties have been very helpful in the recent trends, and they're regularly updating it too on social media.
Yes, yes,
So
yes.
that has been very useful, and people are advised just to collect that information at one place and keep on revising that till the last minute.
So is Facebook full of spam or there's educational material? I mean, what would you advise? How much time would you advise to invest there?
If you just go through all the faculties pages and keep a notification for every post that happens,
Okay.
it will hardly take around 30 minutes per day.
Okay.
Hardly take it.
Okay, okay.
So it's not a waste of time.
Okay, okay. So it is productive,
It is productive.
depending on how well you use it, right?
Yes.
Okay, 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 okay. So it's been very nice talking to you, Diwakar. Especially your inputs have been very, I would say, of help to students. And it would be great if you guys can mail me at marvamedicine.com. You can send me an email at marvamedicine@gmail.com, or you can visit my website marvamedicine.com, and you can send up your queries. And I would also request Diwakar to share his email ID so that you can also help aspiring students.
Sure.
You can just say it out.
It's divu_sharma@yahoo.com. DIWU_Sharma@yahoo.com.
So would you just say that slowly so that they can.
DIWU divu_Sharma
Okay.
at yahoo.com.
Okay, so if you have any queries, you are most welcome to send a query across to Diwakar or across to me, and we'll be glad to assist and help you out with if you have any I would say especially fear factor for any particular subjects. I think this is the man to talk about because he has done it very recently on the NEET pattern. You see, the NEET pattern is a little new in a sense that it is one-liner MCQs, but they are created by people with very high intellect. So what I am finding is people are under impression that one-liner MCQ, it's very simple, इसमें क्या बड़ी बात होती है.
No.
And I think preparing, I think Diwakar, you would agree that preparing for AIMS and preparing for NEET is not the same. National board is totally a different ball game.
Yes.
And I think we at PGDMS are more adept at the NB pattern, so we were able to guide